So hi everyone, my name is Jennifer Greaser. I'm with CDC's Washington office and I'd like to welcome you to today's webinar on CDC's COVID Data Tracker. Our goal for the presentation today is to introduce you to the tracker, the types of data that you can find there and how to navigate the tracker. We'll also cover some of CDC's other data sources and how you can access those as well. We know there's a lot of information on CDC's COVID-19 website. We want to make sure that you know about these great tools and how to use them. A few housekeeping notes before we get started. First, today's presentation is being recorded and will be sent out to congressional offices later this week for anyone who was not able to join us today. Also, just a reminder, this call is not intended for the media and is for informational purposes only, not for attribution. All participants will be muted. You may use the chat box for comments, and we ask that you submit any questions via the question and answer function throughout the presentation. Finally, we'll have two short polls, one now that you should see on your screen, and another at the end of the presentation to get feedback about today's webinar. Please answer the poll now as we get started, and then again as we start the Q&A section. First, we're going to hear from Dr. Paula Yoon, one of the leads for the Data Analytics and Visualization Task Force in CDC's emergency response. She's also the director of the Division of Health Informatics and Surveillance in the Center for Surveillance, Epidemiology, and Laboratory Services. Dr. Yoon provides guidance for the CDC Data Tracker, which includes data from several task forces in the response and is a collaboration with CDC's Geospatial Research, Analysis, and Services Program. Next, we will hear from Dr. Fleetwood Lustelot, who serves as Senior Advisor for the Tracker Development Team, for the COVID Data Tracker, and Ms. Tess Palmer, who is the Project Manager for the CDC COVID Data Tracker Development Team in CDC's Geospatial Research, Analysis, and Services Program. They will provide an overview of the tracker and then will walk us through a live demo. After the presentation, our speakers will answer questions that we received in advance and then those that have been submitted during the presentation. Now I'm pleased to introduce Dr. Yoon to get us started. Dr. Yoon?
Thank you, Jen, and thank you to everyone who has joined us today. As you know, sharing timely and accurate COVID-19 data with the public is a core activity of CDC's COVID-19 emergency response. Today, we'll be showing you many of the aggregate data sources and interactive tools of the COVID Data Tracker. We have an unprecedented amount and variety of data available to us for this response. Much of these data are being collected through our routine surveillance systems, those data collection processes that we use every day to address threats to public health. These include notifiable disease surveillance and mortality surveillance. We've also stood up new data collection efforts in record time. For example, we are collecting aggregate case and death counts from state websites, and the COVID Electronic Laboratory Reporting System, or SEALR, captures positive and negative test results that are reported to CDC from state health departments. While we'll not focus on data available outside of Tracker today, I do want to mention three types of data that you may already be familiar with and which may be of interest. We have data on mortality, including provisional death counts and COVID-19. These are available at CDC's National Center for Health Statistics, NCHS's website. The Hospitalization Surveillance Network, or COVIDNet, is a population-based surveillance system that collects data on laboratory-confirmed COVID-19 associated hospitalizations among children and adults through a network of over 250 acute care hospitals in 14 states. COVIDNet covers approximately 10% of the US population. CDC also makes available public use and restricted access data sets. These include person-level COVID-19 case data with demographics and other information. Sharing data for further research really helps to amplify the scientific impact of the data we collect. You can learn more about these data sets on the website data.cdc.gov. Now I'd like to turn it over to Dr. Fleetwood Lustelot and Ms. Tess Palmer for a deep dive and a live demo of Data Tracker. As Jen mentioned, please feel free to type your questions into the Q&A box throughout the presentation. Thank you, and over to Fleetwood.
Great, thanks, Paula. So hi, I'm Fleetwood Lustelot, the Senior Advisor to the COVID Data Tracker, and we appreciate the opportunity to provide you with a demo today. Before we get into the demo, I wanted to give you a little bit of context. The CDC's COVID Data Tracker combines county, state, national, and global data from across the response in a series of interactive dashboards. The CDC COVID Data Tracker was developed in April 2020 through a collaboration between CDC's COVID-19 emergency response and the CDC's Geospatial Research, Analysis, and Services Program, also known as GRASP. Since April, the COVID Data Tracker has received more than 100 million page views, with 3 million just in the last week. The audience is large, but our intended audience includes data-savvy consumers, policymakers, the media, and others. The tracker has evolved as we have tried to make as much data available as quickly as possible since the beginning of the pandemic, and it will continue to evolve, including the development of a new landing page soon. As you can see on this slide, there are a variety of data available. New tabs displaying different types of COVID-19 related data are added routinely, and the data are updated daily. We recently added vaccination and county level hospitalization utilization data to the data tracker. We are also excited about the development of a new user-friendly landing page that will launch at the end of January. Tess is going to give you a sneak peek of it during the demo. Also coming soon, data on new variant strains of COVID-19, data on the second dose of the vaccine, and school data. CDC promotes the data tracker via social media using easy to interpret graphics that highlight data you can find on the data tracker. We encourage you to share these with your constituents and partners. Now I'm going to turn it over to Tess Palmer, the project manager for the data tracker, to go through the live demo. Tess?
Great, thank you, Fleetwood. Pulling up COVID Data Tracker right now. All right, well, thanks everyone. Again, my name is Tess Palmer. I lead the development team that builds CDC COVID Data Tracker. And shared on my screen right now is CDC COVID Data Tracker. So I want to kind of orient you to what we're looking at, and then I'm gonna do a deep dive into 3 of the tabs that we have available on COVID Data Tracker that I think this group will find very interesting. But please keep in mind, as Fleetwood just went through, there's a lot of data sources and data visualizations available on COVID Data Tracker. So what I'm showing you today is just the tip of the iceberg, and there's much more available for you. So I hope you'll go and look at the site after this webinar. And I'm sure one of my colleagues will pop the link to COVID Data Tracker into the chat for your use. So to start off, I want to show you our County View tab. So you'll see here that I've selected County View up here at the top, and we're in the County View tab. The County View tab is an integrated look at many different COVID-19 metrics at the county level. On the initial view, when you come to the County View tab, you'll see that there are 2 options to update the map that you're looking at. So you first select up here whether you want to see metrics about cases, about RT-PCR laboratory testing, about deaths, or about hospital utilization. And then based on what you select up here for the map, you can choose in this dropdown which specific metric in that grouping that you'd like to see. So maybe if I want to see cases reported cases, but per 100,000 population, I'll click here to update the map based on that. And you can do the same with other metrics. So maybe laboratory testing metrics, and you can see laboratory percent positivity at the county level. On the side here, we have some introduction information about the County View tab to kind of set the stage for what you'll see in this tab. And then at the bottom, I'll point out that there's a cross-link to your state data if you need to see that on COVID Data Tracker. And then we also have extensive footnotes available on each tab of COVID Data Tracker to give you information on any data limitations, data sources, supporting information to help you interpret the data properly. So I'm going to zoom into a specific county, and I'm from Jackson County, Missouri, so I'm going to choose Jackson County. So to do that, I can get there two ways. The first way is to select Missouri here in the drop-down, and then select Jackson, if that's what I want to see. Once I click this, I'll be zoomed into Jackson County. But I want to let you know that you can also just scroll over the map and click directly on your county to be zoomed to that county. So I'm clicking on Jackson County now. And you can see that we've zoomed to Jackson County, Missouri, my hometown. So you'll notice on the left side that you can continue to update the map, just like we were doing on the initial view, to show the choropleth as you'd like it to be shown. But you also get some more information now that you've selected a county. We have 7-day totals for cases, along with percent change, for deaths, for percent positivity, testing volume, new hospital admissions for COVID, percent beds used for COVID patients, and also percent ICU beds used for COVID patients. So these are these numbers that are listed here on the left. And then on the right of those numbers, you see time series charts for each of those metrics. And if you're interested in a specific time window, you can update this time slider at the top to only show the specific time window that you're interested in, and that will update all of your time series charts. And then I want to point out here at the bottom, you also have some community characteristics about the county that you selected. So there are some census variable information like population density and household size, and also some vulnerability information. So we have the ranking for this county's social vulnerability index, which is built by GRASP at CDC. And also the Sergo Foundation's COVID-19 Community Vulnerability Index. So this gives you a nice integrated view of what's the situation in the county that you've selected. So next, I want to move on to another tab that I think you will find interesting. It's definitely been a hot topic over the past few weeks since we've had this available on COVID Data Tracker, and this is our vaccinations tab. So the vaccinations tab currently shows us some high-level US numbers, including the total number of doses that have been distributed across the United States and territories and federal entities, and also the number of first doses that have been administered. We also have some high-level numbers for long-term care facilities also here. And then you can update the map based on what you'd like to see, whether you want to see first doses received by state, jurisdiction, and federal entity as a count, or as a rate, and then the number distributed as a count or a rate. And if you scroll down to look at the map, you can hover over any state or territory or federal entity and get the exact numbers for that location that you're hovering over. I also want to point out that the data table and data download for this tab are also available. And at the bottom, there's a link to CDC's vaccination landing page, which will give you more information about all of the work that CDC is doing to support vaccination in the United States. So I want to show you one other tab available in COVID Data Tracker, and that is the Compare State Trends tab. So in the Compare State Trends tab, it's very cool. You have the opportunity to add up to 6 states or territories into the selection bar. And I'm sure you'll notice the theme. I'm going to add Missouri to the selection bar to show you that when I add Missouri to the selection here, it's also added to the chart below. In this chart, we can look at trends in cases or deaths, either daily trends or cumulative. We can look at these trends as raw totals, so counts, or as rates per 100,000 population. And we can even change the scale between linear and logarithmic. Having the logarithmic scale is very useful when we want to show US data alongside the state level data. And that actually defaults to logarithmic when we show the US data by clicking that checkbox. I want to point out one other thing available on this tab, which is the x-axis here is not date, as you would typically expect with a, showing trend lines over time. The x-axis on this tab is actually number of days since the given outbreak happened in that state. So this allows you to visualize the progression of outbreaks state versus state without, even if they didn't happen at the same time. So this is showing how the outbreak progressed on a different scale rather than time. It's showing it since the outbreak began in that state. As always, you can download the data just below. And on many tabs in COVID Data Tracker, we actually have a button that says download chart or sometimes download map that lets you download a high resolution image of the chart or the map that you're looking at. So before I move on to our very exciting sneak peek, I want to just remind you that we've gone through 3 of the many tabs available here on COVID Data Tracker. So I urge you to take a look at what else is available as far as laboratory testing data, global data, information on unique populations like healthcare personnel and pregnant women, some forecasting data. There's a lot available here, and I think you'll find some useful information for your work. So now I am going to move into our sneak peek. This is a sneak peek of the landing page that we are currently working on for COVID Data Tracker. So we designed this landing page with the user in mind. We want to make sure that when a user comes to COVID Data Tracker that it is as easy as possible to find what they're looking for and maybe discover some things that they didn't know they were looking for, but they'll find useful. This landing page is not yet live on COVID Data Tracker, but it will be live before the end of this month, so please look out for it. I'll point out a couple aspects of this landing page that are very useful. First of all, we have this statistics bar across the top. So this gives you some high-level numbers about the COVID-19 pandemic at a glance. So we have the total cases in the US, the total deaths in the US, trends in cases and deaths in the last 30 days, and also whether the percent positivity over the last 30 days has gone up or down compared to the previous 30-day period. And of course, when you click on any of these statistics, you'll be taken to more information pertaining to the statistic that you selected. And going back to the landing page here, I also want to show you how we've created these curated groups of data to help users kind of find what they're looking for depending on the realm of information that they seek. So in the Your Community section, we have the County View tab, which I've just shown you. We also have a link to the Community Profile Report, the Forecasting tab that shows us modeled weekly cases, weekly deaths, and cumulative deaths. The Vaccinations tab, which I showed you, the Mobility tab, and the Pandemic Vulnerability Index tab. And you'll notice that other groupings are available, just as the Your Community group is. And clicking on any of these cards will take you to the relevant tab. And then the last update for our landing page is this left side navigation. We find that users really like having these left side navigation lists available to kind of see everything that's available, navigate to it, but always have the list available here to get to what you're looking for. All right, so I think that is going to be the end of the demo this morning. I hope you found it useful and hopefully you'll have some questions for me later. But that concludes the live demo portion, and now I will pass the screen and the mic back to Jen to take over. Thank you.
Great. Thank you, Paula, Fleetwood, and Tess for walking us through the tracker. Now we're going to move into the Q&A portion of today's presentation. But before we get started answering your questions, please take a moment to answer a couple of ours by taking the poll on your screen. We've received some great questions in advance, and I see we've got some questions coming in through the question and answer function. We would encourage you to continue sending those in if you haven't already. Of course, if you do have questions after today's presentation, or we aren't able to get to all of the questions before the end of the hour, please feel free to reach out to our CDC Washington office at the email you'll see on the slide, and we'll be happy to assist you. I would also note before we get started answering the questions that while our presenters can answer questions about the tracker, they will not be able to address broader questions on the specific topic areas you'll see there. So if you have questions on those topic areas, you can also feel free to send those to our CDC Washington office and we can follow up with you. So now let me go ahead and get started with the questions. So the first question from Ian, I've received a number of questions from constituents regarding dying from COVID versus dying with COVID from another cause. How does the CDC's data distinguish these, and what can I tell constituents who raise such questions? Paula, do you want to take that?
Sure, I can just give a very high-level answer. The experts in this area are with the National Center for Health Statistics. So basically, a death certificate is completed by a person who certifies the death. The death certificate then goes to the National Center for Health Statistics, where the coding of the death is done. Basically, COVID-19 is only attributed to a death if it is the underlying cause. So if somebody dies in a car accident, but happens to also be positive for COVID-19, they would not be classified as a COVID-19 death. So when people are dying from other acute causes, whether it's terminal cancer, cardiac arrest, if they happen to have COVID-19 and it did not contribute to their death, they would not be classified as a COVID-19 death. As I said, the National Center for Health Statistics does this coding work for the entire country on all death certificates. They're the experts, and if you have more questions about that, we could certainly set up a call or a briefing with them. Thank you.
Great, thanks, Paula. Okay, our next question, I'm gonna actually send this one over to Tess. This specific county view is so helpful. Is there a way to download the county time series trend chart data? That was when you were showing that. Tess, do you want to take that?
Sure, thanks for the question. We realize that the data download will be very useful there, and we're actively working with the data sources and the data owners of that tab to make that happen. So we'll continue to do that and make the download available as soon as possible.
Great. Let's see, the next question. CMS has a more accurate count of nursing home employee deaths. The CDC total is 1,220, but the CMS total for nursing home employees is 1,291. Would it be possible to also reference the CMS data on the CDC site as well? Does anybody want to take that one?
We can definitely look into those. We have lots of, this is Fleetwood, lots of cross links on the COVID data tracker as well, where we highlight different types of data from across the response and try to, as best as possible, integrate those data to provide a more complete picture. So we can definitely explore that further and look at cross linking. Tess, I don't know if you have any additional, or Paula, but we can definitely look into that.
Great.
Yeah, sounds good.
Okay. Next question, for the vaccination data, will that be available on a county level with the new landing page?
I can start to answer that. The vaccination data will not in the very near future be available at the county level. But we meet with the vaccination team every day. So we're already starting, we've already been having those conversations. And when those data are available to share, we'll add them when the time comes. So it's definitely on our minds, but they will not be added in the, in the next few days.
Okay. Again, I'm seeing a couple of questions about vaccinations. We know this is a really important topic that people have a lot of questions on. Questions sort of outside of the data. I would just encourage you to follow up with our CDC Washington office. The presenters here today are just not the right people to answer the broader questions about how the vaccines are being distributed, et cetera. So welcome to take those questions at a later time and follow up with you. There is a question here about, can the system show the number of unvaccinated and/or people who have not been infected along with their demographics by geography?
I can take that.
Okay, great. Thanks.
The system does not show who has not been vaccinated. The system does not currently show those who have been vaccinated by demographic characteristics. That is also another discussion that we've been having for a couple of weeks. What data are available as far as demographic characteristics of those who have been vaccinated, and when we can confirm that those data sources are ready to be shared, we'll add them to COVID Data Tracker. So please look out for that.
Great, and I also mentioned in the remarks as well that there's some updates to the vaccination page that are coming out soon as well, and so the second dose of vaccine will be added and other updates. So there's, as Tess said, there's data being updated really daily and weekly advances and expansion for the data tracker. So the vaccinations page is dynamic as we see more data coming in. We update and expand to respond to the influx of data.
Great, thank you. Okay, a question from Monica. Thanks for explaining we can compare state data. Can we compare county data too?
So we don't have an exact replica of the Compare State Trends tab at the county level, but there's more information at the county level actually all in one place in the County View tab. So you can, compare what you see in the County View tab for one county to another. They're not side-by-side comparisons, but you can compare that way just with two screens next to each other.
Great. Next question from Kimberly. Can you address what demographics data are available on COVID Tracker and how to view those trends? That's a frequent question we get.
Sure, and I think this might be a cue for me I can demo the demographics tab very quickly.
That'd be great.
So let me just grab that screen really quick. All right. So sharing COVID Data Tracker, again, this is what we were looking at during my demo earlier. So if I navigate to the demographics tab, we can see US level demographics information for cases, which are the charts on the left, and deaths, which are the charts on the right. You'll also notice that the titles in these charts give us information on the denominators that were available for these metrics, just to be as transparent as possible, because we don't always have all of the demographic information for our cases and deaths. So we have cases and deaths by race, ethnicity, broken down into the different racial ethnic groups, and you can filter these charts based on any age group that you're interested in. You can also download the chart or the data and view those data in a table form as well. If we scroll down, we can see cases and deaths by age group, and then at the bottom we have cases and deaths by sex, again filterable by age group.
Sorry, I had to find my mute button. Okay, next question from Elizabeth. Have you had difficulty getting the necessary data from states and localities? Paula, do you want to take that one?
Sure, I'd be happy to. Yes, getting detailed data on all of the cases that are occurring across the country has been really challenging. The number of cases of COVID-19 that we have seen, as everyone knows, is something that public health has not experienced before. And the state and local health departments who collect these data are really having a hard time keeping up with the numbers. The information that we are getting on each case primarily comes from the laboratory report, where the lab test report is provided to the states, indicating whether a person was positive or negative. Those lab reports don't have a lot of detail on them. So in order to get more detail about an individual person who's positive, a state or local health department would have to either contact a clinician to get information, potentially interview the individual themselves, link to electronic health record data. So that's why all of the information that we traditionally get on notifiable diseases is not coming in on the COVID-19 cases for the most part. It's just a matter of not having the capacity or the time to do all that extra investigation. So we are limited. We do have incomplete data for some of the data elements, such as healthcare worker status. I know that was one of the questions that people asked about. These data are just very difficult to track down, but we're showing what we have. Thank you.
Thanks, Paula. So we have a question here about the demographic data for people who have been vaccinated, and I would like to suggest that we'll follow up with you if that's okay. We can have our vaccine experts talk with you about that. Let me go to another question here. Says, I'm surprised by how infrequently I see these data and graphics used in the media. How does this data get communicated to the public through the news, radio, TV, and print? And I'll just say we had a question in advance as well that was somewhat similar, which is sort of why we would use the COVID data tracker instead of other sources. So it's potential that these other outlets are using other sources. So I don't know if Fleetwood or Paula, do you want to take that?
I can just say that in regards to some of the data, like the case reports, the data on the laboratory testing, the mortality data, these are data that come to CDC, and we do quite a bit of additional work to the extent possible to verify the data reports that we're getting from states or the data reports that states are posting on their websites. So we do feel that the data that we're sharing through CDC at all levels of geography are really more a source of truth in terms of the data we're sharing. So we need to do probably a better job of really communicating that so people are aware of what we do working with state and local health departments to the extent possible ensure that these data are accurate and true. Fleetwood, did you want to add?
Yeah, I totally agree with those comments, and I would say the response has as well created us to stretch as well. So we've gone from traditional methods in which we have collect and receive data from state and local partners to utilizing new methods to web scrape or pull data from websites in order to collect data from different localities across the U.S. And so this response has, I think, expanded our capacity at CDC, has pushed us into new methods and has allowed us to create new products that I think will be extremely useful in this response as we make decisions and policy decisions and others or support those, but also in the future as well as we prepare for a variety of different experiences with chronic disease, infectious disease, and others. So I would agree with Paula's comments and say that these new methods that we have incorporated into the data tracker as well for the County View tab, for example, are there and we're utilizing for the response.
And Jen, if I can just add to that on the piece of, communications and promotion for COVID Data Tracker. So we have a very strong communications team working with the COVID Data Tracker who've done a great job to promote the different parts of COVID Data Tracker across all of CDC's social media outlets. So if you follow CDC on any social media, you've probably seen multiple posts about COVID Data Tracker. And those are not slowing down. So we're trying to spread the word as much as possible about COVID Data Tracker via social media. And then through webinars like this and with media outlets and with other partners to make sure we can, spread COVID Data Tracker far and wide and make sure that our partners know that it's available to them.
Thank you. This is Jennifer Fald. I also work with everyone who's presenting, and Jen Grisser just had a temporary technology glitch. So I'm going to read out the next question while she gets back online. So there's a question from Monica about the factors that make up the CCVII, and that relates to the Community Vulnerability Index. So that's something that we can certainly follow up with you on and provide more information. So thank you for that question. So we have another question. This is from Michael. Are there any other approaches being used to validate the data being shared by CDC, for example, random sampling, or measures of data quality being collected? So I'm going to turn that over to Paula.
Thanks, Jennifer. Okay, so approaches being used to validate the data. So for example, with the aggregate data, and as I mentioned at the very beginning of this webinar, the aggregate case and death data that we collect is a new data collection system that has been put in place for this response. So we collect the number of new cases and deaths from states every night. Essentially, it's a web scraping process where we pull these numbers from the state websites. We then put the numbers into a survey instrument that goes back out to the states to ask them to verify those numbers. So that's the extra data validation process that we do working with our state and local partners that is not done by some of the other organizations you see that are scraping or pulling data from other locations. So that's one example of validation. The person level data that we receive from our state and local partners, that is the notifiable disease surveillance data. There's a lot of data quality, there's cleaning, there's a lot of work that goes into making those data available for analyses as well. We do occasionally go back to the states if we see something, an irregularity in the data that we need to confirm with them. So the fact that we work so closely with the state and local health departments, we're really, one public health at different levels of state, local, and federal government. The fact that we work so closely with them allows us to see things in the data that don't seem right. We're able to go back to our partners who we know quite well. And this has really served us in terms of the case data we receive, the death data we receive, the new laboratory testing data we receive. As I mentioned, that was a new system we stood up this year. It required a lot of collaboration with our state partners, ensuring the data feeds were working, that we were seeing what they were sending. So there is a lot of work that goes into validation and improving data quality based on the data that we're using here at CDC and what you're seeing on COVID Tracker, frankly. So thank you for that question.
Okay, so I'm going to take some questions that we got beforehand because I do a demo for internally at CDC every Thursday, so I get a lot of the same questions every week. So we were thinking maybe some of you might have these questions. So the first one is, and we've covered this a little bit, but I just want to make sure it's clear. Why would you use COVID Data Tracker instead of other sources of data? So there are multiple sites that have been very useful in supporting this unprecedented event. Of course, people are familiar with Johns Hopkins data dashboard that's been providing global and US data throughout the response, and other sites that frequently scrape data from state and local public health websites. Those ways of collecting data differ from our traditional process of reporting data submitted by our state and local partners, which may result in delays due to reporting and aggregation. So in response to the data needs that we recognized in this response, CDC has been reporting data from our state and local partners while also incorporating some of these new methods of data collection, like Fleetwood was mentioning. So on one hand, with our aggregate data collection, we're displaying the data that are reported to us by states, jurisdictions, and territories. And then when we need, if we don't have those data available in our aggregate data, we've worked internally and with other partners to set up systems to scrape data from websites and things like that to make sure that we can house all of the information available in one place on CDC COVID Data Tracker for you. So we've been continually adapting to the needs of the response and making sure that COVID Data Tracker includes this wide variety of data and that you have one place you can go to find everything that CDC is putting out for COVID-19. This, of course, includes the case and death data, both overall numbers and by subgroup. There's a tab on COVID Data Tracker that I didn't have a chance to demo that that allows you to stratify the case and death trend data by different social factors. So you can stratify by percent of the population over 65. You can stratify by different percent racial ethnic groups and things like that. Fleetwood or Paula, do you want to add anything to that question before I go to another one of our questions that we always get?
No, I think that's great. Thanks, Tess.
That's great, Tess.
All right, I'll keep rolling until someone tells me to stop. So another question that we often get are, how reliable are the data in CDC COVID Data Tracker and what are the data limitations? So my team pulls more than 24 data sources into COVID Data Tracker each day. Each data source has strengths and weaknesses as data go and are influenced by how the data are collected and reported. Each tab on COVID Data Tracker includes an extensive footnote describing the data sources, limitations, and other information to support users in data interpretation. You'll remember I scrolled down to the footnote on the County View tab. It's rather extensive, but that's on purpose so that you can find all of the information you might need about the data sources, any calculations done right there in front of you on the tab. So the aggregate case and death data, the demographic data, the PCR testing data are all reported directly to the CDC by each state and jurisdiction. But for any, for a specific tab and a specific data source, we really urge you to read the footnote so you can see exactly what the source is, anything else you need to know to help interpreting that data. Fleetwood or Paula, would you like to add anything to our data reliability?
No, I think that's great. I mean, it has been very challenging collecting data in the current environment. We do rely heavily on our state and local partners who are all really, burdened by the volume of cases that we are seeing. But there is a lot of work that goes into ensuring what we're putting out on Tracker is the best we have.
Yeah, and I would agree, and also just highlight the richness of that as well. I mean, we frequently in my home division work with one data source or two data sources. We're working on a report or a project, and so to have over 20 data sources that are combined together, it takes obviously a lot of effort to get it into a position to display it. But hopefully that can lead to action-oriented decisions where we can support those at the county level all the way up from the county to the state to the national level. So I just want to highlight the richness of those multiple data streams that are coming in, and then the ability for us to display that through mapping. And people love photos and geography. It's so much more impactful when you're able to visualize something at the county level when you're talking with individuals. So I would just encourage you to grab these maps and utilize those when you're talking to others because of the impact that it can have.
And this is Paula. I can just add on to that because I think Fleetwood made a really important point about the ability to look at multiple sources of data. We have seen in this pandemic how different pieces of data are helpful at different times. So early on, we really saw where the emergency department visits was a leading indicator that was then followed by percent positivity, which was followed by the cases and unfortunately followed by an increase in deaths. And so by looking at all of these different data sources at different periods during the pandemic as things have changed, it really provides a lot of situational awareness for us about what's happening. And COVID Tracker is really the place where you can look at these different pieces at different points in time and follow them over time and really see what's happening. So the information that we're using here at CDC and now putting out through COVID Tracker has been really helpful. So thank you.
So I can also, oh, go ahead, Jen.
Go ahead. Go ahead, Tess.
So I can touch on one other important question that we tend to get, and I think it'll be useful here because we've touched on it a bit, but I want to make sure it's all well understood. So we often get questions about where the county level data come from. So the data on the County View tab, which is the first tab that I demoed for you today, is a great example of our team incorporating these new methods of data collection into COVID Data Tracker. So scraping from websites, automation, rigorous validation checks and things like that. So as of December 12th, the COVID-19 case and death metrics on the County View tab are generated using a data set that's managed by the CDC, and it's compiled from state and local health department websites. So the method that we're referring to is called web scraping. So we're going to the sources of these data and pulling them into one master data set so we can make sure that what we're displaying in the County View tab is what the states and counties themselves are also using. We also filled in historical data into this data set. So we didn't just start on December 12th. We went back in time and used the same method to fill in historical data so that, our trend lines and things like that are also in line with this same method. So you can find more information about the county level data, each data source, where the testing data come from, the hospital data, more about the case and death data, where the SVI and CCVI and other census data come from. All of that is nicely written out in the footnote. So if you have questions about the County View data, I would recommend looking at the footnote.
Great. Thanks, Tess. Thanks, Fleetwood. Thanks, Paula. And thank you to Jennifer Fold also for jumping in. I had some technical difficulties there. We do have one last question that came in through the Q&A. How are you keeping track of whether the data is leading to action-oriented decisions? And I'm not sure if Paula, if you want to say anything there, but I would just say that that might also be one that we would like to follow up with you on if at the CDC Washington office.
Yeah, I would agree. I think I saw that the question also related to the health equity strategy, and I think that would be a fantastic briefing to provide to others as well.
Absolutely. And, as we were going through some of these topics today, we welcome, additional conversations. We're happy to set up separate briefings for you on any of these topics. Just want to make sure we have the right people on the phone or on screen for you. So happy to do that. Okay, here's another question. Any other future leading indicators being developed? For example, time between tests being performed or provider getting results or notifying patients. I'm not sure if we have the right folks on to answer that one. Paula?
Yeah, I would just add that there are a number of new measures or metrics that people are looking at, such as the amount of time it takes from a sample collection to a test result, the amount of time from the test result to the notification to the health department. So a lot of these measures of time can be very helpful in telling us what's happening on the ground. So there is work being done on a number of different data sets related to timing. Those data are not currently on COVID Tracker. I don't think we've quite figured out what that metric is telling us. But if it does turn out that some of these metrics are helpful for informing action or advising about mitigation strategies to put in place, we'll certainly consider adding those as well. But we're really learning a lot at this point. So thank you.
Great, thank you. Okay. I think we don't have any further questions, and we're almost at the end of the hour. So if there are no further questions, I just want to thank you all for all of these great questions and your patience. Thanks so much to Dr. Yoon, Dr. Listelat, and Ms. Palmer for participating on the presentation today. Again, we welcome your feedback on today's presentation and the tracker itself. One last reminder that a recording of the webinar will be sent out to congressional offices later this week, and please feel free to share that with your colleagues if they weren't able to join today. And thanks to everyone for your time today, and please be safe. Thanks, everyone.
Thank you.